Meow.
Huh? Meow.
Hello, my name is Curtis, and I will be demonstrating the anterior and posterior drawer tests. So first, for the anterior drawer test, you're going to want to have the patient lay in a position like this. You're going to want to rest slightly on their foot to avoid their leg or their feet moving up. And then you're going to want to have them make sure they're relaxed with their hamstring and their leg. And get a good grip on the tibia with your fingers in the back so that you can feel laxity would make a positive test is what you're looking for. So they're going to pull forward, feeling for laxity in the joint. And for the posterior drawer test, you would push posteriorly. Feeling for laxity, that tests for the PCL. So the anterior, you pull forward looking for the ACL, and posterior, you push backwards, posteriorly looking for a PCL. So the next test I will be doing is the Athlete's distraction and compression test. So the patient will flip over, and this is looking for a meniscus pathology, where a positive test would be pain specifically. So first, the distraction test, you're gonna push down on the leg right here, and you're going to pull up and twist, creating a torsional force on the leg, and pain would be a positive pathology for the meniscus. If that is positive, the compression test isn't necessarily needed, but if you were to do it, you would support right there again, and then you'd push down on the leg and twist. Make sure you're getting that whole leg to twist to test for pain in the meniscus. And finally, I guess not finally, the next one I will be doing is the patellar apprehension test. So this one looks for...
Apprehensive.
What did I say?
No, you're good. I was just making
The patellar apprehension test, looking for apprehensive. The pathology here would be a sublux patella. So you would take the patella like this and just basically move it like this and ask the patient if they have any discomfort or apprehension with that movement. And that would be looking for a sublux patella as the pathology. And finally, the Q angle. You would take a goniometer and you'd put this on the knee and point the stable arm to the ASIS and the moving arm down the tibia, and you would measure the angle, the Q angle, that way. So.
And then safe value or normal values are?
You want to
10 to 14 degrees.
10 to 14 degrees. So, yeah.
Woo. Hi, I'm Jared, and today I'm going to teach you a couple of special tests of the knee. And since we're on the floor, it's a little weird, but I'm going to start with the varus and valgus stress tests. So what you're going to do is you're going to want to get a slight bend in the knee, about 10 degrees, give or take. And you also want a little bit of external rotation so you can get it a little bit better. And then all you're going to do is you're going to apply force for the vargus test. Vargus is an internal force, so you're testing for the MCL right here. You want to go in between the two condyles and push so that you can feel any laxity. Laxity is a positive test. And then it's the same thing for the varus test, except this time, instead of pushing this way, I'm pulling this way. So same thing, I'm testing for laxity, but this time for the LCL. Yeah. And then the next test I'm going to do is the Thessaly's test. So if you could please stand up. The Thessaly's test, and then you're going to use my hands for a little bit of stability. You're going to bend your knee, and then you're going to go side to side. So this tests for any abnormalities of the meniscus, because meniscus are good to not have hurt. And the last test I'm going to do is the Noble compression test. If you could please lay down. I'm going to put some pressure on here. I'm going to find her IT band on this side. So right in between here is her IT band, right above the supracle. Yeah, your supracle, I think. And then what I'm going to do is I'm just going to push. I'm going to see if I feel anything. Because if there's any pain, she's probably got some iliotibial band syndrome, which is tight IT bands. Yeah. There you go. I didn't miss any, right?
Hi, my name's Shay. I'm going to be showing 4 special tests today for the knee. The first one is Lachman's test. So you're going to put one hand underneath his quad by his hamstrings, and then one hand above on his tibia, close to the knee, and I'm going to push up with this hand and down with this hand. And it's testing for laxity. That would be a positive test, and the pathology is the ACL. And then we have the lever sign test. So I'm going to place one hand underneath his calf and then push on his quad like this, and make sure that his foot bounces up and down.
Look at it, look at it move.
If it does not bounce up and down, that would be a pathology in his ACL. And then the next one is the neck brace test. So I'm going to support his leg with this hand. With this hand, I'm going to put my 2 fingers over his joint line, and I'm going to push his leg towards hip flexion with slight external rotation, and then bring it back out, and I'm looking for a painful click. And I'll do the other side too. Sorry, Chris. And the positive test is the painful click, and that would be a pathology in the meniscus. And then the last one is the Taylor-Ryan test. Please flex your quad. Does that hurt?
No.
And then I'm going to apply pressure using the web of my hand above his kneecap. Can you flex again? Does that hurt?
No.
And then you would just gradually apply more pressure. Does that hurt?
Yes.
Oh no! So a positive test would be pain, and the pathology is PF syndrome, patellofemoral syndrome. That's all.
Dab.